World Alzheimer's Day is observed annually on September 21st. This is for raising awareness about Alzheimer's disease and dementia, promote understanding and tackle the stigma surrounding these conditions. The theme for World Alzheimer's Day 2024 is Time to Act on Dementia, Time to Act on Alzheimer's. Two new drugs, the first ones said to be capable of slowing down the debilitating progression of Alzheimer's disease, have got caught in one of the biggest medical controversies in recent years. For their supporters, the drugs lecanemab and donanemab represent the first real chance to fight the disease after decades of research. For their opponents, they are another disappointment after a long line of costly failures. British biologist John Hardy, who has been studying Alzheimer's since the 1990s, said, "We have turned a corner thanks to these treatments." Rob Howard, a professor of old age psychiatry at University College London, was on the other side. "I think that the drugs have been used to raise false and unrealistic hopes in people with Alzheimer's disease as well as their families," he said. Lecanemab, sold under the name lecanemab, was developed by US pharma firms Biogen and Eisai. Donanemab, developed by pharma giant Eli Lilly, is sold as Kisunia. The controversy has seen countries take different stances on whether to approve the drugs or not. The United States gave the green light to lecanemab in 2023, then donanemab earlier this year. However, the European Union rejected lecanemab in July, a bad omen for donanemab's chance of approval. Last month, the UK took a middle path, approving the use of lecanemab but not making it available on the state National Health Service. What no one denies is that the two drugs are the most effective Alzheimer's treatments ever, but their effectiveness is limited. Both appear to reduce cognitive decline in patients at the onset of their disease by around 30%. While that may seem high, it represents a relatively small difference over the year and a half period when the studies were carried out. The benefits are so tiny as to be practically invisible in an individual patient, Howard said. For critics, there are not enough benefits to outweigh the risks of the drugs, which can sometimes cause brain swelling or bleeding that in rare cases has proved fatal. And they are very expensive at the prices being charged by Biogen and Eisai in the United States. Lecanemab would cost 133 billion euros, that is $148 billion, if given to all eligible patients in the European Union, according to a 2023 study. Advocates of the drugs, including many neurologists, believe they can offer patients a few more precious months of autonomy. They also believe that the effectiveness of the drugs could be multiplied if patients started taking them earlier during the disease's progression. This could be more practicable as research on diagnosing Alzheimer's more quickly has recently been making significant strides. The differing national policies could also mean that the medicines would not be easily accessible to poorer patients.